there's more significance and more prevalence of those signs and symptoms in one leg, so they mask what's going on in the other. We've had patients to where they only want one treated while they have the problems in both. And when we treat that one leg, they realize that other leg had issues too. They just weren't focused on that because the prevalence of it was greater in the other leg. Okay? But with that ultrasound, that's the extent of it. So it's that simple to undergo the ultrasound study to identify whether or not this is a problem you're having, whether or not reflux is indeed the problem related to the symptoms that you're having. So again, the treatment options, 50% of our patients, we recommend conservative treatment, which consists of, again, diet, weight loss, exercise, and compression stockings. The other 50%, we may recommend treatment. And what are those treatments? Those treatments consist of what's called vein ablation. This is the use of heat energy that closes down the vein. And I'll show you a little short video here of this being done here in just a moment. Another recommendation may be ultrasound-guided sclerotherapy. Sclerotherapy is the injection of a detergent inside the vein. It's the same. It's just like utilizing the heat energy, but in turn we're using a solution to close down the vein instead of the heat. The sclerotherapy is typically used for veins that lie a little bit closer to the skin. Those spider veins, that's how we treat spider veins. There are some that are under the skin, but not deep enough to utilize the heat energy. So this is where we would utilize the sclerotherapy. And as you asked me earlier, is it covered by insurance? The ultrasound study, the consultation, and these procedures, these treatments are covered by Medicare and by almost all insurances. This is a little short video that will show you the vein ablation. Typically we access the vein through a little tiny needle. This is the catheter, and this is the heat energy that is being emitted inside the vein. All right, we turn it on, the heat is emitted, it shuts down the vein, and it's like a zipper. We gradually, slowly withdraw the catheter out, and it seals the vein shut. So many of you are thinking, okay, what happens when my vein is closed now? What happens to the blood? Well, the blood gets redirected to all the other veins that are in your leg that are good, where the valves are functioning properly. And as a result now, that blood is able to get out of the legs like it needs to and get the oxygenation and so forth, and it'll be brought back down by the arteries. This is what it looks like under ultrasound. So this is all done under ultrasound guidance, okay? The sclerotherapy, like I said before, it's the use of a detergent that is injected into the vein. What we will also do with this detergent is we add a little air to it and make it into a foamy solution. That foam is then injected into the vein and it fills. So if you have a vein like this and we inject that foam into it, the foam will fill that vein cavity, okay? And then in turn, it shuts down the vein. So it's the same thing as what you saw in the video where the vein is closed down by heat. It's just the use of a detergent and a foamy solution that is injected into the vein instead. It's all done again under ultrasound guidance, which increases our accuracy for accessing the vein. The advantages, how many of you have heard of vein stripping? Or know somebody that's undergone it? Yeah. If you know somebody, it was it's a very rough surgery. What happens with vein stripping is they make cuts. You go into the hospital and they make cuts along your leg that look almost like a railroad track. And then they essentially just pull the vein out. Yes, it's just as rough as it sounds, that's as rough as the surgery is. Okay? That was the old method for treating varicose veins. You were in the hospital, You had to stay there for a period of time. Pain, most patients were in a lot of pain after having to undergo this type of surgery. And the recovery period took a long period of time typically. Well, now with the new method, which is the vein ablation, this is a minimally invasive procedure. When you come in, when you have this procedure, there's no cuts. You're not going to walk away with stitches all over your leg. That little access that we get into the vein, we wrap your leg up with an ACE bandage and you wear that for 24 hours. That's it. You'll put your stockings on for a couple days thereafter. But we ask everybody to leave our office and go back to work if you choose. Walk around, go to the mall. But we want you to be active after this procedure. So you're not going to be bedridden. There's minimal pain with it. And again, we want you to go moving around and being active. The only thing that we would tell you is don't do any heavy lifting more than 10, 20 pounds. That would be the only thing for about a week after your procedure. And in the end, you come out with a better quality of life. For those who are wearing compression stockings, yeah, they're kind of a pain to put on every day, aren't they? But imagine yourself being able to go without them. It's a better quality of life, isn't it? And you get rapid resolution with your symptoms. Often patients will come back. We have every patient come back for a follow-up within a week. And within that week, they come back expressing that the fatigue that they were having, the heaviness, the itching, the cramping has resolved. So you get rapid resolution of your symptoms with this treatment. And there's no loss of work. If you choose to go back to work, you can. Many of our clinics have hours that begin at 6 o'clock. We go all the way until 3:30, 4:30, some 5 o'clock. We actually got a couple clinics that go a little bit later. So we offer times that are flexible for our patients, so that in addition to this procedure not causing you to miss work, we also have times that we offer that can work around your schedules as well. Who are our physicians? Well, our physicians are board certified physicians. They have specialized training in the treatment of venous disease. Who better to have treating your veins than somebody who is specialized in this treatment? Our physicians also do research. Being the leading vein center in this country, we want to be able to give back, and part of our giving back is to show the results of this, how effective it is. So our physicians do a lot of research. They do a lot of educating with surrounding physicians. We do lectures such as this, so that we are educating the community, both the medical community and the community that involves you all, about venous disease. And the other good thing is we have a physician in your local nearby community. We don't want our patients to have to travel a long way to have options to treat their venous disease. We have multiple facilities that are very close to many of you, and we want you to be able to take advantage of that. Again, many of us know, living in this area, spend a lot of time on the road traveling to and fro to get to places, and that's not something that we want you to have to endure by coming to us. Who are our physicians? We have Dr. Lackenpaul. Dr. Lackenpaul is the president of the company. He's one of our physicians that's local to you all. Dr. Satwa, Dr. Skinjaleski, and you'll see they're represented on that form that you have. You can see pictures of them there. Does anyone have any questions?
What is their title?
What is their title? Mm-hmm. Our physicians, many of our physicians are cardiothoracic and vascular surgeons. Okay? So again, these are all physicians that are board certified. They have all undergone specialized training as it relates to the treatment of venous disease.
Have you ever had anybody that was allergic to that? You said that detergent or whatever, you know?
I have not. I myself have actually had it done. I have. And it is a very, very easy thing. You know, it's just a simple injection into the vein. Many people that don't like needles find that this is very easy. So if you have a fear of needles and so forth, I can tell you I don't like them. And I can tell you that this is something that is very simple and easy to undergo. Okay.
I do have one more question.
Go ahead.
I have to get a test, a CT scan that puts dye throughout, you know, so they can see. Without, if you have one like varicose veins in one leg, would that be any problem or no? You know, because the dye goes through your. They put it in your vein, in your arm, though.
Right, but the CT, no.
It wouldn't be any problem. Okay.
Anyone else? So just wanted to, you know, just reiterate a few things. Again, more than 25 million in the U.S. are affected by this common vascular issue, okay? It's a progressive disease. It can begin as varicose veins, swelling, skin discoloration, skin thickening, and then a breakdown of the skin. Again, what are the symptoms? Aching, fatigue, cramping, heaviness, pain, swelling, itching, burning. That's right, you guys got it. All right. And what's the luxury of this? Knowing that this is something that is very easy to treat.